Before I get started, I wanted to give a quick heads up. In this episode, I'm talking about suicide and suicide prevention. I know that can feel heavy or triggering, so please take care of yourself if you choose to listen. And if at any point you want to pause or skip this one, that's completely okay. And if someone you love is in a crisis, you can call 988 in the United States to reach the Suicide and Crisis Lifeline, or you can text 988 or use the emergency resources available where you live.
Every year, it's as if an entire hospital ward filled with doctors, nurses, and colleagues vanishes without a trace, lost to suicide. Behind each of these lives is a story, a family, a friend, and a community changed forever. I'm inspired by the Lorna Breen Heroes Foundation to talk today about suicide prevention for physicians and healthcare workers. Today, you'll hear more about Dr. Breen's story to shine a light on awareness and on hope. Because noticing the signs and connecting with someone in need and advocating for mental health can literally save a life. My hope is that this episode is a reminder that awareness matters, action matters, and connection matters. Together, we can turn awareness into action and despair into hope. Find the full transcript and bonus resources for physician moms at inspiredmommds.com/78. You're listening to the Inspired Mom MDs podcast. I'm your host, Dr. Cindy Van Prague. I help physician moms reconnect with what truly matters by taking back control of their time and energy so they thrive at work and at home. Thank you so much for joining me today. In honor of Suicide Prevention Month in September, today's episode is dedicated to suicide prevention for physicians and healthcare workers. This conversation is both urgent and hopeful. Suicide Prevention Month brings up so many emotions: a sense of loss for friends and colleagues who died by suicide, relief for those who got help when they needed it, and urgency to spread awareness for those struggling right now, today. My message is one of hope. With the power of community, the impact of your individual action, and the reach of awareness, people can get help. They don't have to struggle alone. Now, I don't presume to truly know what someone struggling feels deep in their core, but I do know the perspective as a mother, a friend, and as a physician all too well. I do want to bring awareness to the scope of this illness nationally too, especially for healthcare workers, and most concerningly for female healthcare workers. Awareness breeds alertness, and alertness leads to intervention and advocacy. Now, the statistics on suicide are sobering and demand our attention. In the United States, according to the CDC in 2022, suicide was the 11th leading cause of death overall in the United States, claiming the lives of over 49,400 people. Now, this was hard for me to comprehend. So I was thinking, I looked up the stadium capacity for the Johan Cruyff Arena in Amsterdam, Netherlands. I was there just last year on July 4th for a Taylor Swift concert. And for the stage setup she had off to one side of the field, the arena could hold about 50,000 people. And it was a sold-out show. And I remember being in that arena looking all around me at the swarms of people. Now, it's hard to imagine all of those people lost to suicide over the course of a year. Now, these statistics, when broken down by age group, change a bit. Suicide rises from 11th place up to the 2nd, 3rd, or 4th leading cause of death, depending on the age range. And when you break down these statistics by gender, you find that men have an age-adjusted suicide rate 4 times higher than women in the U.S. Okay, but what about the numbers for men and women in medicine? They are strikingly different. Female doctors have a 53% higher suicide rate compared to females or women in the general population. In contrast, male physicians actually have a lower rate compared to male non-physicians. And female And female nurses are 8.5 times more likely to die by suicide than the general female population. And I'm talking just about US statistics because women physicians are more likely to die by suicide here in the US than in other nations, though attention is certainly warranted in other countries, and I do have an article linked in the show notes that includes other countries. The numbers can shock us, but behind every statistic is a colleague, a friend, a human being, which is why it's so important not just to understand the data, but to recognize the warning signs in the people around us before it's too late. So how do you notice when someone might be struggling? Well, sometimes the signs come out of nowhere. I'll tell you the story about Dr. Lorna Breen. She was a dedicated emergency physician. She was a sister, a daughter, a friend, and she was the cool aunt to 8 nieces and nephews. She spent her career caring for patients at the New York Presbyterian Hospital in Manhattan and ultimately served as director of the emergency room at Allen Hospital. Now, in the spring of 2020, during the peak of the COVID-19 crisis, Dr. Breen was working grueling 12-hour shifts, treating incredibly sick patients with severely limited supplies and limited staff. And she would stay beyond her shift to help her coworkers out, and they would do the same. Extreme exhaustion and emotional strain escalated to the point where she couldn't even stand. But she feared seeking help because of the potential stigma and professional consequences. She feared for her job. For those who aren't in healthcare listening, allow me to explain. Medical licensing boards throughout the country require disclosure by the applicant of any current or past mental health care in whatever level. Hospitals also require disclosure for credentialing, and seeking mental health care is considered a sign of weakness among many medical professionals. Now, Lorna had no prior mental health issues. She was a smart, funny, sarcastic woman, yet she died by suicide on April 26, 2020. Her story is a stark reminder that sometimes, despite outward appearances, those struggling may go unnoticed, even among colleagues and friends and loved ones. Now, other times the warning signs are visible, but they're easy to brush off or rationalize. And still other times the signs are just loud and clear. So one way to approach how to look for warning signs in others is by using the acronym HEART, like your beating heart. This is from the Physicians Foundation, who has an initiative out to help prevent physician suicide by recognizing the warning signs. These are like vital signs, and of course the acronym applies to not just physicians, but everybody. For the word heart, each letter is a vital sign. Health, emotions, attitude, relationships, and temperament. For health, you may see increased use of medications or alcohol or illicit drugs, or the person may be talking about wanting to hurt themselves. It may be pretty obvious. Now, the E of heart is for emotions. Experiencing extreme mood swings or feeling hopeless or having no purpose fits emotions. A in heart stands for attitude. So being negative about professional and personal life or having inappropriate outbursts of anger or sadness would fit this. The R in heart is for relationships. The person may be withdrawing or isolating themselves from their family and friends and coworkers. They may be talking about being a burden to other people. And finally, T in heart is for temperament. They may be acting anxious or agitated or behaving recklessly or just being uncomfortable or tired or in unbearable pain. Now, some of these are subtle or hard to recognize at first, and some are really obvious, right? Maybe you've noticed a coworker who's withdrawing or had a change in their demeanor or are saying that they're struggling outright. But the purpose of memorizing this acronym is just one way to help us be the ones who notice and who take action. I found the more I talk about suicide with people, the more comfortable I get. So I'll start with basic questions like, I've noticed you seem different lately. Is everything okay? Or if they do open up a little, I'll say, you're not alone. I care and I'm here for you. And I'll ask the direct questions, and I usually lead with, are you thinking of harming yourself? Or I may ask, are you having suicidal thoughts? It's just a matter of fact. A lot of physicians and healthcare workers are hesitant to seek help. This is such a huge issue. So gently remind the person of some confidential resources if they're not in a crisis at that moment. Top numbers for immediate help are to dial or text 988. That's the National Suicide Crisis Hotline. There's another great number staffed by psychiatrists helping physicians and medical students called the Physician Support Line. This is in the U.S. The number is 888-409-0141. That's 888-409-0141. There are several other resources that are in the show notes, and they're written on the website page for this episode, which is inspiredmommds.com/78. Please feel free to check those out. So it can feel uncomfortable to be speaking to a friend or patient with these direct questions, but it does get easier. And as always, asking questions out of concern and support will help, and they're not going to drive people to acting on their thoughts. You're going to help them. So knowing what to say and where to find help is powerful, but your impact doesn't have to stop there. You may want to take the next step, becoming an advocate for suicide prevention and healthcare worker wellness. I took that next step, and now I am honored to serve as an ambassador for the Lorna Breen Heroes Foundation. This organization was born from the tragic story of Dr. Lorna Breen that I just discussed. The foundation fights for the professional well-being and mental health of healthcare workers through several initiatives, and they have so many successes, more than I can list. But here's one. You know those intrusive mental health questions on licensing applications I just talked about? The foundation fights to have those removed. And I'm so happy to report that as of May 22nd, 2025, there is one dental licensure board, 37 medical licensure boards, 5 nursing licensure boards, and 7 pharmacy licensure boards verified their licensing applications do not include these questions. Now, this affects nearly 1.4 million licensed healthcare workers. So, shout out to the Lorna Breen Foundation. They have multiple other ways that you can take action, from organizational down to the individual level. So I recommend checking out their website to get started. And there are other ways too, outside of the foundation, to get involved in advocacy. It can be as simple as just posting about mental health awareness. It could be as simple as encouraging a friend to use some of these mental health resources that we're talking about. Or it could be supporting local programs that provide healthcare worker mental health support. I have another resource. It's from the Suicide Prevention Resource Center. They have a PDF full of ideas to take action starting now to help prevent suicide. I have a link in the show notes for them, so you can take a look at that PDF. And that PDF has links to other things too, so you can just go down a rabbit hole and find what fits for you. Every small action amplifies the message that seeking help is a sign of strength, not weakness, and that no one in medicine should face these struggles alone. I really appreciate you joining me for this episode on suicide prevention for physicians and healthcare workers. I just discussed the scope of the problem with current suicide statistics and highlighted the importance of staying alert to the warning signs of suicide in colleagues with the HEART acronym. If you or someone you know is struggling, please don't wait. Please reach out. You can always call or text the National Suicide Crisis Hotline at 988, but also check out the other resources in the show notes or on my website, inspiredmommds.com/78. Today, I aimed to bring awareness, to highlight resources, and to foster hope. Suicide Prevention Month is a sacred reminder of our colleagues that we've lost and the family and friends who carry that grief. But awareness matters all year long. So if you're listening, take heart. Your voice and your questions and your reach could save at least one person's life. And a big thank you to the Lorna Breen Heroes Foundation for leading courageous conversations in healthcare. You inspire hope and action and healing. Don't forget to join me next week for another dose of support and inspiration. Until then, take care of yourselves and take care of those who matter most. It's time to take control and thrive. Thank you for tuning in today to the Inspired Mom MDs podcast. If this episode resonates with you, please share with a friend who may benefit too. And I humbly ask, please leave a review so other doctor moms can find me too. It helps. Thank you.
And just a quick reminder, this podcast is for informational and educational purposes only and isn't a substitute for medical advice or care. I'm a board-certified physician, but this content isn't connected to my clinical practice and no doctor-patient relationship is formed here. Please always talk to your own health professional about any mental or physical health concerns. Please see inspiredmommds.com for full disclaimer.